Today we're taking care of somebody's kidney stone. This nice gentleman presented with right-sided flank pain, and he has a big kidney stone right where the kidney starts to become the ureter. So what we're going to do is, these days, instead of having to open up a patient and actually remove the stone, we use technology instead. We use ultrasound waves to break apart the stone. We use small cameras that go through the urethra, enter into the bladder, enter up the ureter, and can use the laser to break apart the stone as well. So let's get started.
Thank you. All set.
I'm going to need a 5-inch open-ended ureteral catheter. So right now we are just examining the whole bladder like we always do to make sure there's nothing else going on in this patient that could be bad. So then we go to the tube called the ureter, where it enters into the bladder. So then we go to the tube called the ureter. Flora? Okay, so we've now gone up in the bladder. We've now put a wire to gain us access past the stone, and we're now going to go look up into the ureter and even into the kidney, because he actually has a history of abnormal urine cytology, which means that we talked to him about it, and we're going to just look in that kidney and make sure there's no cancer cells in that kidney as well, or cancer in that kidney. Flora? Stop. You need more contrast? Okay, so here's the stone. Okay. I don't see any cancer or anything. Do you see the stone with, Fleur? Do you see the stone I'm looking at? Mm-hmm. Okay, can I get the laser? So I now use a laser the size of a hair. Okay, fluoro, let's see if, make sure we still see it. We still see it. You see it's 3 clusters now? Good. No, it's okay. You did perfect. Okay. And we're done with that part of it, okay? The tube that we just went up, called the ureter, is about 2 to 3 millimeters in diameter. That stone is about 7 millimeters to 8 millimeters in diameter. When you figure out the actual size difference, like an 8 millimeter stone, you know, in diameter is way too big to fit usually through a 2 to 3 millimeter tube. His stone, was sitting right at where the kidney became the ureter. We pushed it into the lower pole of the kidney, then went up, broke it apart with shock waves, looked through the kidney like we had told him we would to make sure there was no cancer growing, which we don't see. But now, you know, we broke apart the stone, and now we're going to put up a stent to allow him to pass some of those pieces. At the same time, if you imagine, if I take a 6 millimeter scope and put it through a 2 millimeter tube, the tube would swell a little bit. So what the stent is for, it's to make sure that the tube does not swell too much and block off the kidney like the stone is blocking off the kidney. So essentially, almost everybody gets stented after one of these procedures to ensure that your kidney stays functioning and that you don't have a problem. The stent will come out in a week after he passes his little stone fragments, and he'll be good to go. Hold on. Oh, don't pull the wire. Fluoro. Thank you. So we put the stent over a wire. Once we look on the fluoroscope, on the fluoroscopy, that this stent is in the right place, and we see here that the stent is in the right place, we're able to know that everything is perfect. Unfortunately, these cases are messy. Okay, we're done, guys, with this part. For this patient, we completely destroyed the stone. He's now going to pass those small little pieces without a problem. Here at North Broward Medical Center, we do about 10 stones a week here because we're in Florida, which is considered the stone belt. So we get a lot of stones. And for a stone surgeon, the motto is, it's not how much stone you take out, but how much stone you leave in. And in this case, it's going to be 0.